Good morning, everybody. Hope you're having an amazing day so far. Today, we're going to be doing something a little bit different, going through the process of looking through our different healthcare options. So we're basically going to be looking at the different health insurance plans we could choose to purchase. And we're probably not actually going to sign up on this video because that's a process with a lot of personal details and stuff like that. Yeah. We basically wanted to take you guys along with us so you could kind of see what our health insurance options look like here in the U.S. and specifically here in Indiana. It does change a little bit depending on what state you're in, but generally speaking, the costs are pretty similar across all the states, but they do differ just a little bit. But where do you want to get started?
I really don't want to get started, but if we must.
All right, guys. So I guess we'll just talk through this as we're going through here. As you can see, we're reviewing the plans for all three of us two and our daughter, Sophia, with an estimated effective date of January 1st of 2026. So this is the current options.
And this is our first time seeing the prices, so
I did see the price for our current one. You haven't, but I actually saw the price for this one and I clicked on it.
The current one that we have?
Yes. This is actually the current insurance plan we actually have for 2025, but the price is going up through the roof.
Oh, great.
Yeah. So you ready?
I guess.
All right. Dun, dun, dun. This is about the bottom of the barrel before we look at this price.
Okay, so it's going in order of like worst to best?
Usually does that.
Okay.
Yeah. Okay. So it gets better and more expensive as you go. As you see here, we got 55 total plans: bronze, silver, gold, and platinum. As you can imagine, they go up. You pay more in premiums, what you're paying per month, but you'll have lower deductibles, lower copays, and more. You have just better stuff.
And this is something that Steve usually handles every year on his own, pretty much. Like, I don't normally look at it with you or like, you know, like I try to disassociate.
Yeah.
But I know we were paying quite a bit last year per month. And now I'm not looking forward to seeing, because each year it's gone up incrementally. So I know it's going to be more expensive.
I will say this, that starting about 15 years ago, health insurance just started skyrocketing. Health insurance actually used to be very affordable here in the U.S., at least in my experience. Like, I remember back in probably around 2010, my insurance, for good insurance, I had good insurance, I had a low copay, low deductible, and it was only about $70 a month. You know, it was really good. You know, granted, I was young at the time. That does change things a bit, but nonetheless, very good insurance for a very low price. But then within 2 years, my insurance premiums and deductibles had skyrocketed. My premiums had like tripled, maybe quadrupled in like 2 years after that.
And it's only gotten worse.
Yeah, it has. So, all right, guys. Yep. So here we go. What is the bottom of the barrel? What is the monthly payment on the bottom of the barrel plan?
Worst plan, basically.
Worst plan. Here we go. So the bronze, $7,500.
And this is the plan we have right now, right?
Yeah.
But not at this price.
Not at this price.
Okay. All right.
That's surprising.
$1,228 a month.
$1,228 a month.
For the worst plan.
For the worst plan. Now, granted, all right, guys, so I'm going to explain this real quick. As you can see here, we have adult vision, which means the vision is covered, if you want to call it that. And then we have fitness, which means that we get a free gym membership.
Ooh, free, not that great gym membership.
Yeah.
With our $1,228 payment.
Yeah.
Thanks so much.
Woo!
Wow, that's crazy.
As you can see here, no dental covered. And basically, a lot of people outside the U.S. probably don't really understand the difference between deductibles and out-of-pocket maximums and things like that. So
I don't even understand it, really.
All right. So you have copays, which I think everybody understands a copay. A copay is what you pay
when you go to the visit
at the time of service as an added thing on your premium.
Yeah. So the $1,228 a month
just gets you in the door.
The end all price.
No. See, like I think if we had to pay $1,200 a month for the three of us, and we were like covered, we're
for
good.
Everything. Yeah.
That's like okay, yeah, that's cool.
I mean, well, it's still expensive, but it's like at that point, oh, okay, I'm getting something for my money. But
and I want to say this, that the average person doesn't pay the full premium. And why that is because in the U.S., you can get a subsidy on your taxes based on income. But it dramatically decreases the amount of the subsidy. You know, by the time you're getting into a decent middle class income, your subsidy is, you know, very small.
Right. So
but
you're paying most of that out of pocket.
yeah, but if you're basically here in the U.S., in 41 states, if you make a very low income, I think it's around 21,000 a year, maybe I think it's about $21,000 a year. You're actually covered under Medicaid in 41 states, meaning that you basically have free health care. So low income people are generally covered with free health care in the majority of the country. And then it's like, then if you start making an income that you don't actually qualify for Medicaid, you will have a subsidy that will cover a large portion of this premium.
Yeah, it's kind of like a sliding scale.
And then it's a sliding scale, and you eventually lose out on the subsidy.
So anyway, $1,228 a month, estimated yearly cost of $19,000.
Yes.
Oh my God.
Based on medium use of medical services.
So if you go to the doctor more, obviously you're going to be paying more.
Now here, what is a deductible for anybody watching that doesn't understand what deductible is? A deductible is the amount you would pay before you can use the majority of your health care plan. So you're paying this amount per month, and then you need to pay.
Like if you had to go to the hospital.
Right. If you had to go to, like you can look down here, emergency room, you pay 50% of your emergency room bill after you pay the $15,000 deductible for a family.
Yeah. So your health insurance doesn't kick in until you hit the $15,000 that you
Partially.
pay.
But here's the thing. That's not completely the case, but for example, if you just need to go to a doctor visit, you're going to go get some blood work or something done. You pay $50 a visit, and that covers it. But it doesn't cover necessarily everything. You might have extra lab costs and stuff like that.
The more we talk about this, the more insane it sounds.
Yeah. If you want to,
ridiculous.
Like if you need to go to physical therapy, we pay this per month, you know, granted whatever subsidy you may or may not get. We're not going to go into all that. We don't even know what subsidy we qualify for this year yet because I haven't really looked into it. But you know, it could be that maybe we pay $1,000 a month or $1,100 or who knows what it'll be. It could have to pay it all. I don't know. But the point is, after you pay that premium, you would then pay
per month.
Per month. You would then pay if you wanted to go and you had to go physical therapy or something. A specialist, you would pay $100 per visit, and that would cover your specialist. But as we see here, you're still paying this.
And still, if you go to the emergency room, still got to pay the $15,000 before your
that's family total. Usually, it would probably be about $7,500 for each of us.
Okay, well, still.
Yeah.
And then not including if you go to the doctor, like you said, you pay $50 for the visit. But then if you, like you said, need labs, you got to pay extra for that.
Yeah.
And then your prescription, if you need a prescription for anything, you got to pay for that. So
Yeah.
it's like...
Well, the good news is generic drugs, $25, are not too bad. $25 for prescription drugs, most of them. And honestly, if you go to Walmart or something, you can usually get prescription drugs for really cheap. I'm talking
depending on what it is.
Like a lot of stuff we've gotten for like $3 or $5, you know. So it just depends on what it is. But generally speaking, for most drugs, it'll be about $25 unless you go with the name brand stuff. Here's something to think. Actually, this is the big reason to have health insurance right here, guys. And that is the out-of-pocket maximum, which is simply the most you'll pay for covered services in a plan year. After you spend this amount on deductibles, copays, and co-insurance for in-network care and services, your health plan pays 100% of the cost of covered benefits. So basically, we pay our monthly premium, and then you get a massive bill from the hospital. You pay $20,000 and everything else after that is covered. So if it was like a $200,000 bill, you would have to pay you continue paying your premium, and you pay your $20,000 as a family total, and you're covered.
It's just crazy, though.
But the
$20,000.
It really
plus,
is.
Plus the monthly amount.
Right.
In a year, that's a lot of money.
Let's take into consideration this is a bottom of the barrel plan.
Exactly.
But also
the worst plan.
But also so the plans get better deductibles wise and stuff.
But the price goes up.
The price goes up. Yeah. So it's like you've kind of got to start at the beginning of the year because you have a very limited window of when you can sign up for these plans unless you have some sort of like change in life.
Extenuating circumstance.
Right.
Like, what is it? A life event or something?
Yeah. You have a new child or you move, you get married or something like that. But yeah, so we do get a fitness plan with this one. Yay!
Everyone rejoice.
Yay. The individual total for out-of-pocket maximum is only $10,000. Plus your premium again. I got to make, you're paying this and then you spend $10,000 between your individual deductible and co-pays, you're covered for the rest of the year after that.
Which you would hope you'd hit that earlier in the year rather than later.
Yeah, you would hope so. So this is the first one. We're going to go through and look at some of the other more expensive ones, but I think most of you probably understand now. A copay is basically what you pay when you go to a doctor or a service. You pay your $50 or your $100 or whatever it is.
Just to see the doctor.
Just to be seen that day. Yeah. And then that's usually your deductible doesn't come into play until you're doing more of you're getting something bigger done. Emergency stuff. Maybe you're going to get blood work that wasn't suggested by your doctor. Perhaps your doctor doesn't want to get a full panel of testosterone or something, and you decide you want that for some reason. You would then probably have to pay your deductible, meaning you're basically going to pay that out of pocket. All right, guys, so I just scrolled down a little bit because a lot of these are going to be very similar, just have slightly different structure and a little bit different pay. So this one's actually a little bit cheaper per month, but I want to show what the difference on this is. Now your deductible's gone up. That's why it's a little cheaper. Your deductible went from $15,000 as a family to $20,000 as a family. And basically, this one's funny, right?
Oh my gosh.
You get it? You see it?
Yeah.
So the reason it's cheaper is that you literally are not covered with anything until you pay your actual deductible.
So if you're paying $1,013 a month, and if you have to go to the doctor for any reason, you have to pay all of that out of pocket.
Yes.
On top of your $1,000+ a month.
Yes. Let's click on this and you'll see what it would be for an individual.
Oh my goodness.
All right, guys, so as you can see here, you would pay $1,013 a month unless you got some sort of subsidy. And you would then have a $10,150 deductible. And remember, nothing else was covered on it. Like the plan we were showing originally,
first plan,
you would pay like $50 to go to a doctor, and you wouldn't have to. It wouldn't be under your deductible. So it's just like $50. You can go see your doctor and whatever. You were what was it? $100 to go specials like physical therapy or something like that, and it wouldn't be under your deductible. With this plan, you're paying over $1,000 a month again, unless you get a subsidy, and you've got to cover the entire $10,000 of healthcare services out of pocket before they actually cover anything else.
This is highway robbery, man. This is insane. This
is what you call a bottom of the barrel catastrophic plan because you're basically, look at this, hospital visit unlikely. Basically, this is like, I want to protect myself just in case the worst of the worst happened. I don't go to the doctors very much. I don't go to the hospital very often, stuff like that. That's generally, we don't use medical services that often, thankfully, knock on wood.
Probably because we freaking have to pay an arm and a leg.
Well, I wouldn't just go for no reason. I'm saying, thankfully, we haven't really needed to.
We would probably, do things like, blood work and that regularly. But
we get blood work. You can get blood work under your just going to the doctor. You get physicals, annuals is what they call them here, where you go and you get they check you out, do a little basic blood work, your cholesterol, your A1C numbers, and all that jazz, and that's covered under. You don't even have to pay a copay for that necessarily. Okay. But otherwise, yeah, that's what we're looking at. So let's move on to the next one. All right, guys. So now we have the next level up of plan. We were on bronze plans before, and now we're on silver plans. And this one, obviously, as you can see, about $1,200 a month. And as we explained, the deductible was a little lower on this one. I don't know what that would be per individual. I guess we can click in here and check. But see the difference here. When you get to a silver, you definitely start seeing better options. Now, the interesting thing is our plan we have is about the same price. Mm-hmm. But we had, what was it? It was vision and fitness. We had the free or the included healthcare, gym.
Which, personally, I don't feel like that's worth
right.
paying.
But this is $25 to go to see a doctor, $65 for a specialist, $75 for urgent care, and $500 copayment after deductible.
Wait, so once you've met your deductible on this one, you still have to pay $500 each time?
Go to the emergency room. And here's the thing. If you just go to the emergency room, think about it. If you just go to the emergency room, if you're not admitted, like maybe you were there for a number of hours and it was just some sort of emergency that's not so much of an emergency, you're like in the hospital for days, it's not going to cost you $14,000 or, well, $10,000 or $5,000 even. It probably cost you maybe $5,000, meaning that you're going to cover that entire that emergency room visit entirely out of your pocket, right?
Oh my gosh.
So, but look at generic drugs over here, $3, and obviously that's $0 select drugs. This is more of a plan for people that do a lot of prescription drugs. And I think that's one of the biggest takeaways from when we're having to choose our healthcare plans here in America. You've got to look at your lifestyle and how much do I truly use different types of medical services? How likely am I to have to go and use this, or my family to use these different services? And then you kind of weigh the pros and cons and the cost to determine.
That's why this gives me such a headache, because it's so confusing.
Yeah.
And so, there's just there's too much information.
Yeah. I get it.
I feel so overwhelmed.
It can be complicated. I mean, for us, it's not as complicated as some people because we don't use a lot of medical services, thankfully. But nonetheless, it's still pretty aggravating. All right, let's continue. Let's move on. All right, here's an interesting one. 10% co-insurance after deductible for literally everything. So you pay your deductible. What is that? Deductible here, I know a lot of people looking at this is probably like, oh man, that's still a high deductible. I see that.
It is very high, but
I see that and I'm like,
compared to the other one,
that's not bad.
Oh.
So you would pay $6,500 per year on top of this monthly payment.
Per person, right?
This is per
individual.
Well, see, the interesting thing about this is this isn't including, for some reason, the deductibles
aren't including the child.
Well, if long as 2 of the 3 people
meet the deductible,
right? Then
ooh, it's buy 2 get 1 free.
It is buy 2 get 1 free. That's good. Yeah. So
that's saving money.
That's kind of interesting. And then you would basically have your 10% co-insurance up to you meet the maximum out of pocket, which is $16,900 per family, $84.50 for.
I don't understand how you understand this.
I've just looked at it for years.
What is coinsurance?
Well, coinsurance is simple.
10% of coinsurance.
Coinsurance is simply, I'm going to pay this as. I mean, it's what it sounds like. It's coinsurance. You're partnering with the insurance plan, basically to say I'm going to okay, you met your deductible, right? Okay, now you go to the doctors and it's $500. Your coinsurance 10% means you're going to pay $50.
Okay, so whatever the insurance negotiates to, you pay 10% of it.
Yeah.
Okay.
So I mean, here's the thing: if you had once you met your out of pocket maximum, not bad if you needed a lot of healthcare service.
Yeah.
But the problem is it's complicated and it's just expensive, especially if you don't use it
for
very
what
often.
you get.
For what you get. Yeah.
All right, so this is another silver plan?
Another silver plan, but the difference is this is Focus Silver plus Vision plus Adult Dental. Basically, you're now up to $1,400 a month for your premium. Your deductible is it's going down per individual. I guess this would be $6,300. Your out-of-pocket maximum per family. Basically, yeah, you're just throwing that Adult Dental and Vision in. What do you think? Yeah.
Honestly, seeing all these numbers, it just makes me not want to have health insurance. I know that's a dumb idea, but it's like to the point where the price is so ridiculous per month.
Yeah.
That it just feels like overwhelming.
Yeah. Well, you know, we might go with a, what you call it?
Health share.
A health share plan.
We've never done that. We've talked about it before. That's another option in the U.S.
Yeah.
It's basically like you pay into
and basically
a fund.
You have a pool of people who all basically pay in per month. And then basically everybody shares the cost for other people in the plan when they, you know, have an issue. They pay the bill. And so it's definitely a much lower cost option. Usually you could probably do that for, you know, $400 a month, you know, something like that. Maybe $500 a month, $300 a month.
I feel like those are only going to get more popular because this is crazy.
Yeah, those are definitely going to get more popular. Guys, don't you just love how it says low premium? Low premium silver. Doesn't really look that low to me. All right, guys.
Oh my gosh. Is this the first gold one?
There's a couple other gold ones here, but this one is about $1,900 a month, as you can see. But look at your deductible. That's much better, right?
I don't know, man.
Now, this is one of those, like, you know, you're getting to the top of the line plans here.
That is insane.
I mean, think about this.
But I love on this one how you don't have a deductible.
You could pay about $1,900 a month. You don't have a deductible. So here's the thing. What happens? $5 to go to the doctor. Okay? $60 to go see a specialist. $35 to go to urgent care. 30% of your emergency room. That's where they get you. But your out-of-pocket maximum is probably $6,500. So once you pay $6,500 in total health care cost per year minus your premium, you would be covered for everything else.
But 30% of your emergency.
No, that's up to the point you get to your out-of-pocket maximum.
So there's still a cap.
So you pay this, you pay about $1,900 a month, and then you spend $6,500 the rest of the year. Everything beyond that's covered.
Honestly, this one might be the best option.
Yeah, if you're pretty sure you're going to use a decent bit of health care, it is. It's a better option to go with that.
It's still like I do not want to pay $2,000.
I mean, think about that, $1,900 a month. Now, granted, you know, again, some people get subsidies. You know,
man, I'd be using the heck out of that thing.
I know, right? I know. You would want to.
Doctor would know me by name.
Hey, Lizzie, you back? Oh, it's good to see you.
We just have to laugh or else we'll cry. At this point, I mean, it's just so ridiculous that...
This is pretty much the same goal plan we were just looking at, but they added vision and adult dental. And I can't remember what that was, 18-something. This was 1940. So this is just a little bit more.
$100 more, maybe?
I don't think it was the $100, maybe, though. But, you know, for less than $100 a month more, you get vision and dental.
Let's just ball. Let's do
ball
it all. Let's just make it
Yeah! All right, guys. We are still not even in platinum yet.
There's more above this? I thought gold was the top.
No, platinum. But somehow, I'm not even sure. Look at this.
This one seems like a way worse deal.
Yeah, now we are a few $100s even more expensive at $6,000 deductible versus what was zero. So I have no idea what.
And your out-of-pocket maximum's higher.
$10 per visit from day one.
I guess 10% of the emergency room. But after your deductible.
That's what it is. It's 10% after your deductible. But I'm not sure how we would have to look at that. Obviously,
that doesn't seem like a big deal.
We are not going to be getting a health insurance plan like this. No. This is like a Cadillac. Yeah, we're not doing that. We're going to go with the Honda basic package because we're not going to go get a Ferrari here.
Does the Honda have rims or no?
I don't know if the Honda has rims. I don't even know if the Honda. I don't even know if the Honda comes with tires, honestly. But you know, I don't know if we can afford seat belts or airbags. So I think we're going to probably be avoiding
Lord.
this. Gold, $15 generic drugs.
We're still on gold?
Yeah. To get $15 generic drugs, you only have to pay the low price of $2,300 a month.
This is crazy.
And remember, guys, this is for a family of 3. If there's a family of 4, family of 5, or 6, or whatever, it'd be even more expensive.
Look at the estimated total yearly cost.
I know, family total.
$31,000. That's people's yearly income.
This is well. To be fair, again, we got to take that into consideration.
That's true. But
if you had a yearly income of $31,000 as a family, you would not be paying this amount. You would be paying much, much lower because of subsidies.
Still, it's just crazy.
Yeah, like, a lot of this is determined off of subsidies, but still, the fact is that if you've got $2,300, even if you're getting a good subsidy, you're going to be paying. Even if you're getting a huge subsidy, you're going to be paying $1,500, $1,700, $1,800. She has not seen. This is the top of the line Cadillac plan.
Like the best plan you can get.
This is the best plan.
Oh my gosh.
And are you ready?
Great. And remember, this is only for 3 people.
Yeah. You ready?
Okay.
Open your eyes.
I'm scared. $2,800
$2,800 a month. So you got to imagine if this was a family of 4, this would probably be, I don't know, $3,500 or something like that. Add an extra kid. I have no idea. And that's insane because think about it. Granted, you have no deductible. Think about this. Okay, you have no deductible. You pay this. There's no deductible. I go to a doctor, spend $10. Go to a specialist like physical therapy, pay $20 a visit. Go to urgent care, $15 a visit. Emergency room's $100, right? And then you're going up to a yearly out-of-pocket maximum of $5,200. It looks like.
So the out-of-pocket maximum, once you hit that, like $5,200 for the year, then would the emergency room be free?
Yes. Okay. Everything would be free after that point.
Oh, okay. Even doctor's visits.
Yes.
Okay.
That's the key here, guys. And I think it's hard for people to wrap their heads around. The out-of-pocket maximum is what it sounds like, is the out-of-pocket maximum.
The most you could possibly pay.
The most you'll pay for covered services in a plan year after you spend this amount on deductibles, co-payments, and co-insurance.
Everything else is covered.
So you pay your premium no matter what.
Yeah,
and then you start going to the doctor, doing this and that with medical services, and then you spend as an individual probably $5,200, and all of a sudden everything after that point is covered. And so
$5,200 plus the monthly payments per year, which is how much you would pay.
Yeah, the monthly payment plus $5,200 as an individual or $10,400 as a family. The rest of the year is covered, all costs except for your monthly payment. Which the monthly payment is huge.
Yeah.
But I think this goes to show that what this type of plan is for the person that knows for a fact they are going to be doing crazy amounts of doctor stuff.
Okay, well, here's my question.
Because your doctor stuff, your visits themselves aren't that expensive, so you'd have to go to a lot of doctor visits to actually equal up to that $5,200 based off of this. Here's
my question. So let's say you pick your health plan for the year, and you choose like one of the lower plans because you don't. You're guessing that you don't need it. And what happens if you choose the low healthcare plan and then someone goes into the year and they get diagnosed with something? Are they then allowed to change their healthcare plan, or do they have to keep the one they chose?
I haven't had that experience, obviously,
right.
But from what I understand, I think you're stuck with your original healthcare plan because you have limited reasons why in the middle of the year you can change plans or whatever.
Well, you would think a health diagnosis would be one reason you could change.
Yeah, but when you look at the reason for insurance in the first place, it kind of goes against their for-profit model. If you're able to just okay, I didn't need it much this month, but next month I'm going to need a lot of stuff. So
it's all based on the gamble of, will I or won't I need it?
It really is, and weighing that with how much do I really want to spend? How much?
Right.
Yeah, it is a gamble in certain ways because
do I want to pay up front?
You're gambling.
Thinking I'm going to need it, or
you're gambling one of two ways. You're gambling and saying, I'm not going to need it. I can save a bunch of. Well, you're not saving money. What am I saying? You're not saving money, but I can spend less money. Or I'm going to think maybe I will need it, and I'm going to go and spend a bunch of money per month that I may actually not even use.
Right.
So it's a
It's stressful.
Yeah, it's stressful. It's not really, once you understand the system is not really complicated, but it's complex in the fact you've got to weigh everything in a month, basically, period of time to determine what's going to be the entire next year of your healthcare costs.
So y'all are lucky. I think you already know that, but seeing this, I'm sure you feel even luckier.
Yeah, and there's a couple things I do want to say here that that in some ways doesn't make the system sound as bad. Number one, a lot of people think, I don't know where this stereotype comes from, thinks that people are just dying on the streets if they don't have health insurance. It's not the case. Number one, like we said, low-income people in the majority of states, 41 of our states plus DC, you qualify for Medicaid if you are if you're low income.
Yeah.
Number two, if you are low income but a little higher than you qualify for Medicaid, you basically get a very low cost health insurance because you'll have a large subsidy. It's really when you get on into a middle class income is when you start struggling with the healthcare costs mostly in this country for most people. But the other thing to think about is that by law, healthcare providers cannot deny you service, especially if it's an emergency. You go to the hospital, they can't just turn you away. Now, you won't be, when you go to a hospital emergency, they don't ask you, like, do you have insurance or whatever? No, they treat you and then you have to deal with the insurance bills afterwards.
If you have a family member with you, a lot of times the family member will be at the check-in desk giving that information.
Yeah, but I'm saying that is not a requirement and that is not something that you have to actually go through. You're literally in the middle of like, I don't know, you've got some severe pain.
You're in a car accident or something.
They're not asking for your health insurance or plan.
Oh, you don't have health insurance. We're not taking you to the hospital.
And I think the third thing to talk about real quick is that in the U.S., most hospitals, the vast majority of hospitals have something called charity care, a charity care department. They have different names for them. The charity care is what they usually call them.
Right.
And basically what that is for if... it's not, you don't even have to be low income on that. Usually it's like 300 to 400% of poverty, meaning like 3 to 4 times poverty level. So you can have a middle class income and actually qualify for charity care at a lot of hospitals.
Yeah.
And what that means is you'll go in there and you'll be like, I can't
write a letter or something.
You don't have to write a letter.
Sometimes
you go into the department and you actually just show them your income and you have to fill out a form or whatever. They go through the process of qualifying you, and if you qualify because of your income, your bill will either be majorly reduced or even written off completely. Yeah. So there are things that are positive about our society, but the main difficult thing is when you are middle class, you have to go through this process of looking through these healthcare plans, which are absolutely insane.
I think the biggest thing after all the points you've mentioned is that yes, these things are available and possible, but it's the hoops that you have to jump through to get it or to keep it or to plead your case to hope and pray that you get the forgiveness on the loan or the bill. It's stressful. It's very stressful. And not to mention the monthly amount that you have to pay in a lot of cases is stressful. So
right.
You know, that's something that a lot of you guys in the comments have mentioned, how you're so thankful that you have the NHS, because when there's a health issue or when your family member is going through something horrible, they don't have to stress about how they're going to cover it or how much they're going to end up having to pay, you know. So I think that's a big benefit of universal healthcare and the NHS.
Yeah, every healthcare system.
Peace of mind.
Yes, very much so. Every healthcare system has pros and cons, but that's definitely a benefit when you have the peace of mind. You don't have to stress about this is how you're going to pay or what you're going to pay. At some point, our country needs to start taking care of us as people better. Yeah,
as the people paying into the tax service.
Yeah. We get. I mean, I would say our taxes aren't bad as a whole in this country, but we don't get much of anything for it.
Right.
You know, and I think that's the big issue. You don't mind paying in some decent taxes when you're actually getting good services for them. But like this right here is a good example of what's messed up with our system. It's like people have to go through and choose these plans, and and depending on what subsidy or help you might get, it's almost always going to be at least somewhat painful financially to do this for an average family. But guys, we just wanted to take you on a little journey to look at our healthcare options. These are all you saw here were not all the options we have here. We obviously didn't want to go through every single plan because a lot of them are very similar.
They're just,
But now you know. You don't know, we got bronze, silver, gold, and platinum, and they go up high in price depending on what you want. And you want the Honda, you want the Cadillac. That's what it is.
With tires or without.
Yeah, without tires or you want a steering wheel, might be extra. You want a radio. I don't know. You want carpeted seats or you want a bench. But guys, I think that's it for today. Thank you so much for stopping by. Let us know in the comments. What'd you think about all this?
Does it make you extra super thankful you have the NHS?
Yeah, like if you're not American,
or whatever other health service you guys have in your country.
Yeah, like obviously I understand most people, if you're not in the U.S., in your developed nation, you mostly have some form of universal health care. And you don't generally, from what I understand, most of you aren't going. I know if you have the NHS, you don't have to pick out anything like this. But I think we've heard that some universal health care plans, some countries may have some sort of insurance. And I'm not sure if it's how it compares to this,
right.
But I'm almost certain that it doesn't cost nearly these prices to cover your own health care. I mean, absolutely ridiculous. But before we go, I do want to say, just like I've said many times, I think this goes to show what I'm always talking about, that, like we said, most people in the U.S., if they're low income, they're covered by Medicaid. Okay. And if you are making, I don't know, if you're wealthy and you're making, hundreds of thousands of $1 million a year, you're making $500,000 a year. That's not that bad, right?
Yeah.
But it's the people in the middle class that you are sitting here and you're weighing these options like, my goodness, man, which do I choose? But
they're coming for us. We gotta go.
Oh yeah. Oh my goodness, they're coming for us. We showed you the truth. Do you hear that?
U.S. healthcare exposed.
Anyways, guys, thank you so much for stopping by. Please click that like button. Feel free to drop your comments or suggestions about this video or others. And don't forget to subscribe to continue to follow us on our journey. Until next time, peace.
Bye.